Hello everyone, this is Dr. Saroj Siddiqui from the platform of UKMLA with DSS. So let's just move on to our next lecture and next category. That is a very important category, which is called the teaching stations. Okay, so in the Plat 2 exam, you would experience and you would see not maybe just one, maybe two cases in your exam, in which you have to teach a colleague and teach a student, or maybe you would have to do some teaching for the parents as well, or for the a relative of a particular patient as well. Okay, so you need to be like really well versed with the teaching stations, as I mentioned that you can have more than one of these stations in your exam, and these are like very easy, and at the same time like it's very difficult as well, because there is a separate way to go about it, there's a different way to go about it. Okay, and a lot of people are able to crack it and a lot of people are not able to crack it, because the kind of impression that a lot of candidates and a lot of IMGs have regarding the teaching station is that it's just one way speaking, and we just we're just going to go out there and we're just going to showcase our knowledge, and we're going to just verbalize whatever we know about a particular topic, and we'll be good to go about a teaching session. But that is not the case. The teaching sessions needs to be a two-way conversation. It needs to be very IPS oriented, and then there is significant amount of data gathering involved in the IPS sessions as well. And a lot of candidates, they get confused that okay, Dr. Sarosh, what is exactly data gathering and what type of data do we gather? Like this is just a teaching session. The students coming to us because they don't know uh, what the topic is and they want to learn about it. So what are we going to gather from them? And like even if we ask questions, what kind of answer should we expect, and should we ask those questions or not? Are they just a waste of time, or should we just go out there and just display our knowledge and just verbalize our knowledge? Okay, so I'm going to address all of these confusions, and what I'm going to focus on is basically the basics of the teaching sessions. Okay, and this is something that you would need to keep in your mind, and just keep on following it every teaching session. And after this lecture, you will be very much prepared, and you would be good to go in the teaching sessions that are there in Lab 2. Okay, so let's just start with the beginning. Okay, the very first thing is the repo building. Okay, or the IPS. Okay, so it is like really essential in the teaching session that you build a very good rapport, because unlike in most of the countries from where the IMGs come from, there is a very strong possibility that you may not find tutors, you may not find doctors, who are very nice, who are there to make you comfortable, who are not rude. Okay, so there's a very strong possibility you may have encountered a senior doctor who is in a teaching position that may not be the nicest person over there. But in the UK and in the NHS, there is no concept like that. Okay, if you're rude, if you're not making the student comfortable, if you're not talking nicely to the student, then you don't deserve to be at a teaching position, and then you cannot stay at a teaching position. You need to be really humble, and you need to make sure that you are building a very good rapport with the student before and during the teaching sessions as well. Okay, so that is one thing. Moving on, you need to introduce yourself, and since the person that you would be teaching would be one of your colleague, it would be your junior medical student, a nursing student. Okay, so do not add the abbreviation of doctor. Okay, just introduce yourself with your name, that okay, I am Sarosh, I am Siddiqui, one of the FI2 doctors here. Okay, do not say I am Dr. Sarosh Siddiqui. Okay, just say I am Dr. Sarosh, one of the FI2s here, or one of the FI2 doctors here. How are you, Adam? Okay, and then ask about a couple of questions, that okay, how is your rotations going? Do you have any exam coming up? And then try to talk about how his medical school life is, how his study life is going. Is he having any difficulty in studying? How is he finding the studies of a med school or studies of a nursing school? Okay, and then try to come to the topic that okay, I understand that you would like to learn about whatever the topic is. I understand that you would like to learn about vaccination schedule. I understand that you would like to learn about ECG. Am I right, Adam? And then they're going, yeah, doctor, I want to learn about ECG. And then you can ask them, okay, any what particular reason why you want to learn about ECG. And then they're going to say that, yeah, doctor, I'm rotating in the A&E, and uh, I see multiple patients with chest pain, and the doctor's orders an ECG, and a lot of medical intervention depends on it. So I really want to learn about it, and then you would appreciate that particular student, that I really appreciate your enthusiasm for learning. And indeed, ECG is a very very important diagnostic test that we do, and it's very very important for all the healthcare professionals to know what an ECG is, and to be able to identify the abnormal finding in the ECGs. And then try to use these lines that, okay, I will try my best to explain it to you in the best way possible. Okay, don't worry, I'm going to explain everything to you. I really appreciate your enthusiasm. Okay, try to use these terminologies that would help you build the repo that is needed. Okay, and then in the beginning what is expected of you is you gotta like make sure that you give this disclaimer that this particular topic is a huge topic. It's a big topic, and if we are unable to finish it, what we can do is that we can reschedule for another session, or I can give you some reading resources. I could give you some online resources, or some study material which you can read as in homework, and you can understand this topic better. And why you need to say this is a like really really important thing. Talk about rescheduling, or talk about having another session. Why is this important? Because just think about it, it's an 8-minute station. Okay, and that is what they want to see. There is no topic in the field of medicine that can be taught in 8 minutes. Okay, it's practically impossible to make sure that you have taught someone each and everything in 8 minutes. Okay, and expect them to understand each and everything as well. Not exactly 8 minutes, but even less than 8 minutes, like 7 minutes. Okay, because in 1 minute, you would be doing introduction, and you would be doing the repo building and all. Okay, so 6 to 7 minutes you cannot teach a topic. All right, and this is something that I would like to point out, that just because it's a huge topic and you've got little time, do not rush into the teaching. Okay, do not just go very fast, and do not just uh, you know uh, like focus on just completing the topic in 6 to 8 minutes. Okay, your job is not to do that. Okay, make sure that you're not going very very fast. Okay, and make sure that you are covering the important parts. Okay, or the important things, or the things where you should be having your main focus. Make sure that is completed in 8 minutes. Okay, and the rest of the things, you can reschedule, or you can schedule another teaching session with the kid for that. So you can just say that, okay, a lot of things would be left, so what we can do is that we can have another session. So make sure that you have set this line before, like in the beginning, because at the end you would be rushing, your time would be like coming to an end, and then you would forget saying this. And even if you remember saying it, you would say this thing in a very very rush. Okay, so just say this thing in the beginning, so that you are safe, and you're giving that impression to the examiner that you understand that such a big topic cannot be covered in 8 minutes. Okay, cannot be very effectively delivered in 8 minutes, and you are open to the idea of having multiple teaching sessions, and and you are basically making sure that the student that is coming to you, they understand each and everything very very properly. Okay, so yeah, these were like a few IPS pointers. These were a few things that you had to do in the beginning, and the kind of details you need to throw in to make sure that you build a very good rapport with the student. Okay, now the million-dollar question, that Dr. Siddiqui, what is the data gathering? And we don't understand that what type of questions should we ask, and it's a teaching station that student wouldn't know anything. Why do we ask the question? Do we still ask the question? So the answer to your questions is that yes, you need to ask a bunch of questions. Okay, even if the student is unaware about the topic. Okay, you need to still throw those questions. Okay, and it basically varies from case to case, the type of questions that you need to throw, and I'm going to discuss all of that later on in the lecture, at the end, once I'm done with the basics, that what are the important and what are the essential data gathering questions that you need to ask. But there are a few common questions that you can ask in literally every teaching session, like what do you know so far about this particular topic? What do you know about the ECG? What do you know about the vaccination schedule? What do you know about developmental milestones? What idea do you have about the informed consent? Remember, in the other session, in the counseling sessions, we used to do something known as the ICE, in which we assess the idea, their knowledge. Okay, so even though they did not have a lot of knowledge about it, we asked that question nevertheless. So you need to keep that same concept in the teaching sessions as well. That how much do you know about the topic? Okay, and if they want to learn about a particular medical intervention that you may have to perform, like for example, somebody may just come to you asking to learn about the abdominal examination, or maybe the use of EpiPen. Okay, and all of these things, are the kind of things that somebody have to perform. So you can ask about them, that do you know how to perform an abdominal examination? Do you know how to perform a urine dipstick test? Have you ever performed a urine dipstick test? Have you ever done an ECG of a person? Okay, so try to ask if there is, if they have, had the hands-on experience of a particular topic that they want to learn. Okay, and then, as I mentioned earlier on, that 8 minute or 6 to 7 minute is not enough to teach a topic completely. Okay, so now how do you know that, okay, what is that important thing, what is the particular thing where your main focus should be? You're going to get to know this thing if you are going to ask this particular question. It's a very essential question, that what specifically do you want to learn about the topic? Like for example, somebody wants to learn about the BLS protocol, the basic life support protocol. It's a huge protocol, SRABC, CFT response, airway, breathing, circulation. Okay, like there are 5 different aspects. Okay, and teaching all of those in detail in 6 to 8 minutes, it's not possible. It's not practically possible. Okay, so if somebody wants to learn about BLS, just ask them, okay, what specifically do you want to learn about the BLS? Okay, so they're going to say, doctor, yeah, I just want to learn about how to give a CPR. Okay, or I just want to learn how to give rescue breaths. Okay, for the ECG, it's a huge topic, multiple waves, multiple segments, and they've got multiple pathologies. There can be some rate related issues, there can be rhythm related issues, and there can be electrolyte anomalies as involved as well. So a lot of things, are there in ECG. But ask them, what specifically do you want to learn about ECG? Maybe they want to just learn about the pathologies that the ECG like shows. So you're just going to talk about that. Okay, the ECG changes in pericarditis, the ECG changes in acute myocardial infarction, the ECG changes in pulmonary embolism, in hyperkalemia, in hypokalemia, in first degree heart block, second degree heart block, then atrial fibrillation, supraventricular tachycardia. Okay, a lot of things about the pathologies. But maybe they just want to learn about the waves. They want to know about what the basics of the waves are. Okay, so what does the P wave stands for? What does the QRS complex stands for? How does the T wave form? So we're going to talk about that. Okay, the T wave form because of the ventricular repolarization. Okay, so just the details of the waves, that QRS is basically depolarization. Okay, so the knowledge about the waves would be the main focus. All right, so it really depends on station to station, and you wouldn't know that where to focus until unless you ask this question. Okay, and then another basic question that you can ask, that any reason why we perform it or why we do it. Like for example, any particular reason why we do the ECG? Yeah, doctor, because we want to learn about the heart pathologies. Very good. Any particular reason why we have the vaccination, schedule, or why we do the vaccination? Yeah, doctor, because we want to prevent the children from different kind of infections. Okay, any reason why we do the urine dipstick? Yeah, because doctor, urine dipstick and urine can tell a lot about different type of disease that are going on inside the body. Okay, so any reason why we do it? So you see, 4 questions, like this, like so basic that it needs to be asked in every question, and every topic. Okay, and then candidates come to me and say that, doctors, there is no data gathering in teaching. What do we ask in teaching? So these 4 questions are the one that you need to ask in every station. Okay, And then there are some additional essential data gathering questions. Okay, and I'm going to talk about those questions later on once I am done with teaching the basics. Okay, all right. And there are like 3 to 4 different essential questions in every type of station. Okay, so a together of 7 to 8 questions that you need to ask. All right. Then in the very initial lectures, I taught you that data gathering is not just the questions that you ask. It's basically, your technical and your assessment skills as well. Okay, and your technical skills play a very, very important part in the data gathering. Okay, and the props. Okay, there would be something or the other that would be provided to you in the teaching stations. Okay, like for example, I'm going to share what kind of props or what kind of additional materials, I would say, not exactly props but additional materials that you would have in every type of teaching stations, and how you are going to use that. Okay, like for example, as you can see on the screen, on the vaccination timeline or the vaccination schedule station, you may have this particular type of a play card in which the vaccination schedule would be mentioned. Okay, so you need to pick up this placard and you need to show it to the student and teach while using the reference from it, that as you can see that on the 8th week there are 3 type of vaccination. As you can see, the boy holding 2 small kids, that means that this is given at a very, very earlier age. Okay, that means that, and since this is the very, very first picture, and the child is very, very small, so that means this is the first vaccine that we need to give, and that is given in the 8 weeks as it is mentioned here in the picture below. Okay, so try to use the props. Okay, try to use the material. Okay, you can just talk about it, that okay, the first vaccine is the 8-week vaccine, and this is given, and this is the first vaccine that is given to the child. It has got 3 vaccines. Okay, you can do it like that as well, and you can use this picture and point out and show that what is written. Okay, so try to use these props and use the additional material that is given. Okay, then same can go for the developmental assessment. Okay, the developmental milestone, you can teach it with this reference as well, that okay, as you can see, Adam, that there are 4 different domains of developmental milestones: gross motor, fine motor, speech, and social. Okay, and then in the ECG teaching, you may just get a ECG. Okay, and you would have to talk about the rate and the rhythm. So just give them the example that okay, as you can see, that this is the P wave, and this line that enlarges is called the QRS complex, and this is followed by a T wave. Okay, so try to use these pictures to make sure that you are using the stuff that they've given to you, and you get a score on the technical part of the data gathering as well. Then in the urine restrict teaching, they would give you this bottle and this urine dipstick material. So try to use that, try to handle it and show them that okay, this is the box and this is the strip that is given that needs to be dipped in the urine sample. Okay, and there would be other samples as well in the urine dipstick that you would have to use. And then you can see in the BLS, there would be a mannequin given in the adult BLS and in the pediatric BLS. So you have to use the mannequin and show them how to do the CPR, instead of just saying that okay, you need to put your dominant hand and then lock your elbows and then do 30 compressions followed by 2 rescue breaths. You verbalized it, fine, but you did not use the mannequin, you're not going to score well, you're going to lose the marks on the data gathering. So actually perform it on the mannequin, perform the CPR on the mannequin. Okay, that is what using the props is that is what using the prop means. Okay, and then there would be some inhaler teaching as well, that okay, how to use an inhaler, how to use a spacer device, and then how to use an EpiPen. So you can see that there's an EpiPen and there is an inhaler device. Like materials like these would be provided to you in the exam. So make sure that you are using all of these equipments, and you are using these play cards or these information infographics basically to teach, and that is something that will help you get an additional mark in the data gathering. right. So yeah, that was what the data gathering, and that is what the IPS was. Okay. Now comes the management. Okay, what you need to do in order to score high in the management. So number one, you need to teach the relevant content. Okay, and you need to use the props that is given in the station. Okay, that will also help you in the management pointers as well. That okay, you know how to utilize the study materials, and you know how to utilize the additional materials that is provided to you. Okay, so that will get help you get some mark in the management as well, like along with the data gathering. Okay, and then one very important thing, keep on asking for clarity. Okay, keep on being like this, that okay, do you want me to repeat, is everything clear? I can repeat it to for you, even if you want me to repeat it 10 times. I'm going to make sure that you understand the topic. We're not going to proceed forward until you are comfortable with the topic, until you have understood the topic really really well. Okay, so keep on asking them that if there is a need to repeat the content that you are teaching. Okay, so make sure that you have the habit of this. Okay, if you're taught one thing, let's suppose you're teaching ECG, so you talked about the anatomy of the heart, and then before moving on to the waves, just ask them, is the anatomy of the heart clear to you? All right, do you want me to repeat what the four chambers are and what their responsibilities is? Okay, that is perfect. I hope that is clear in your head. Okay, so now since you're aware of the four chambers of the heart, let me tell you what these waves represents and what each wave have to do with the particular chamber. Okay, so then you will transition. Okay, this is how you would have to transition to the topic, but make sure that you have asked that whether or not it's whether or not the topic is clear in the head or not. Okay, and one very important thing, this is something that really a tutor would tell you, but I advise the students, and I advise my students to talk about one of the pathologies related to that particular topic. Okay, and this is like really really important. And what are the stations in which you can do this? You can do this in the cancer referral stations. Okay, like for example, in the cancer referral station, you can talk about the cancer management. Okay, that okay, if somebody is having suspected cancer, they're sent to the specialist on a 2 week wait referral pathway. Then we do a biopsy, and once the biopsy result shows that there is a cancer, we do chemotherapy, and we do surgical removal of the cancers. Okay, then you can do this thing in the developmental milestones as well, that if somebody is having a developmental delay, then they are sent to the pediatrician, and they're seen by different counselors and speech therapists and physiotherapists and mobility and child mobility specialists to see why there's a developmental delay. Okay, and then you can do this in the ECD teaching, in urine dipstick teaching, in subcutaneous injection. And how you can do that for the ECG, you can just talk about MI, that if somebody have ST elevations, then they need to be sent to the A&E, give morphine, oxygen, nitroglycerin, and a blood thinner medication called aspirin. And they may be seen by the cardiologist, and they may want to do something called the angioplasty, in which there is a stent that is inserted in the blood vessels to make sure that it's completely open. Okay, and then in the inhaler technique, you can just talk about the very quickly talk about the management of asthma. And then in the uh, EpiPen teaching, you can talk about anaphylaxis management, that once you're here in the A&E, we're going to give you intramuscular adrenaline, and we are going to put you on oxygen therapy. Okay, so you can ask about talk about the management pointers. And another thing, uh, in the urine dipstick as well. Okay, what you can do is that maybe you can just pick up a disease that is related to the urine, either UTI, and then you can just very briefly talk about the management of UTI, that okay, if you perform urine dipstick and you find that the findings are in line with a urinary tract infection, what you can do is that you can start the patient on antibiotics, and advise them to drink lots and lots of water and do not hold their pee. Okay, so this is a really important thing. Okay, uh, talk about one pathology, not all of them. Like for example, ECG is going to have various different pathologies. You're not going to talk about all of them. Okay, but just one pathology, and very briefly just talk about the management of that particular pathology. This is something that will really help you in scoring high in the management when it comes to the teaching sessions. Okay, and this is going to take your management to a very high level. Okay, so yeah, now let's just move on to the categories. Okay, as you can see that there are four categories of teaching session. Number one is the category in which you just have to teach the content. Okay, like for example, the vaccination schedule, it's just a content that you need to teach. Cancer referral pathway, it's just a content that you need to teach. Then developmental milestones, again just content. And informed consent is again a lot of content that you need to teach. Okay, so there is no intervention involved, and there is no like hands-on involved. Okay, you'll just maybe just have a play card or a infographic that you would have to use to teach the student. Okay, so it's just going to be talking and not standing up from the seat. Okay, then the procedure of the intervention teaching. Okay, in and these are topics like ECG, urine dipstick, subcutaneous injection, BLS, pediatric BLS, and urine dipstick. Yeah, so urine dipstick is already there. I just wrote it again. Never mind. Yeah, so in all of these type of stations, you would have to use some props, and you would have to very aggressively use the material that is provided to you, and you would have to talk about the procedure and talk about that particular intervention. Okay, then teaching a mother, it's basically inhaler technique that you need to teach to a mother, and the use of EpiPen. And there are three different type of examination that usually comes as teaching sessions as well, like for example the abdominal examination, the testicular examination, and the pulse speculum examination. Okay, so these are the like four categories, and around 10 to 12 different type of teaching session that we need to do and we need to cover. Okay, so that is pretty much it for this lecture. In the next lecture, what we are going to discuss is the essential data gathering questions that you need to ask in every different type of teaching session, and what should be your main management pointer, and what should be your main focus of the management for different type of teaching sessions. So see you in the next lecture for that. But if you've got any questions and any queries regarding the basics of teaching, then please drop them down in the comment box below, or reach out to us on our social media, and I'm going to address all your concerns. That's pretty much it from my side. See you in the next lecture.